So for feeling, this is about emotional order, emotional harmony. So extrovert feeling, as it sounds, looking externally and then making sure there's external emotional harmony outside of you. Basically making sure other people feel good and making sure, well, doesn't always necessarily mean feel good. You're just basically looking at emotional harmony. What you do with those emotions, you know, is up to the person. But yeah, but what are some tasks that require you to prioritize extrovert feeling, ensuring emotional harmony outside of you?
Well, I think the biggest way that plays out in residency specifically is you want harmony with your co-residents. And so I'm someone who's always super aware of like, okay, that person saw this many patients. I need to see more, or I need to do this to help them, or I just want to always feel like I am in harmony in terms of workload balance between the members of a team. And I always want to feel like I'm pulling my weight or even over pulling just a little bit to like be a good team member. With your patients is important and being on the same page as them and just treating them well. But the people that you interact with on a day-to-day basis, I think that's where it's most important to me to feel like we're on the same page. I mean, for me, at least, I think if you're just a normal, competent, emotional person, it's not really that, like, yes, there are some difficult patients, but you have minimal interaction with them when you're in the room. And I don't think it's just to be nice and have harmony with them is not that difficult, unless, like I
really
said,
isn't. No.
Especially abrasive person. But with your colleagues, that you can have a lot of tension with the people you work with on a day-to-day basis, and there can be a lot of resentments that build up with workload. So yeah, to me, that's what immediately comes to mind.
Yeah, so kind of getting at that, being attuned to other people's emotions versus your own. So that's where introvert feeling comes into play, being attuned to inner emotional harmony. So what are some tasks that require you to make sure that you have good inner emotional harmony and prioritize that, you know, you're feeling well to do these sorts of things?
So inner emotional harmony, I think, well, yeah, this gets to the faith aspect of this talk, probably for me at least, is I just really throughout, and I remember applying to medical school and then applying to residency, the question was always, how are you going to take care of yourself and deal with the stress? And for me, yeah, exercise is important and tapping into family connections is important, but more than anything, I lean into my Christian faith. And I've always kind of just had faith that things will work out for the best, and that someone, this higher power I believe in, has my back. And so is how I kind of keep my sense of calm, harmony, and peace, especially throughout it's a very rigorous road becoming a doctor. And keeping the end in sight, keeping the bigger picture in mind with faith as your stronghold has been instrumental for me.